Good evening, everybody. This is Don Shepard. I'm the Scout Executive of the Michigan Crossroads Council. I'd like to welcome you this evening to the webinar. We're going to talk extensively this evening about the returning safely to the scouting program plan. And so a couple of housekeeping things this evening as we proceed this evening. If you would like to use the chat feature to write down questions, we would be interested in answering those at the close of the presentation. If after tonight you continue to have questions and you talk to families or committee members, etc., you can send those questions into safescouting@michiganscouting.org. And you'll see that address on several of the slides as we go through the evening. So if for some reason you didn't get a chance to write that down, you're going to see it several more times. All right, so appreciate your attendance this evening, and without any further ado, we'll get started. Next slide, please. So the objective of tonight's meeting is to, this whole process rather is to keep kids safe in the program, keep it available, accessible, and flexible through health and safety measures. So through a changing health and medical, legal, social, and financial environment, we're doing the best we can to provide the materials necessary for us to reintroduce an in-person scouting program. So tonight we're going to talk about a variety of ways and measures that we're going to ask our local leadership to get involved in order for all of our chartering organizations, leaders to be safe and to provide the best program we can for our kids. On the next slide, we have a little bit of a history of how things have unfolded for us. And what I would like to share with you this evening is, we've been in the dark just like you have through this entire COVID process, just waiting on the next information to come from either the CDC or the state of Michigan Licensing and Regulatory Authority, one of those defining state or federal agencies that was going to give us permission to return to scouting. So in March and April, as we were beginning to understand what COVID was, and we were seeing all the terrible information on the news, etc., our council executive board, along with our enterprise risk management committee and a number of professionals, were working together and trying to understand the legal, regulatory, licensing, and insurance ramifications of COVID. It took a while for all of that to unfold. We also immediately jumped on the opportunity to begin to build an essential scouting program that could be delivered virtually, because a virtual program was better than no program at all. And so we had thousands and thousands of families participate in a variety of virtual scouting programs, from camporees to marriage badge clinics to courts of honor. All kinds of things were done online in order to keep scouting moving in a virtual way. We were able to bring our employees the necessary technology, et cetera, to work from home, so that they could continue to offer the support to the scouting program in the form of tracking and answering questions and continuing to enter data into the system and really be engaged in the process of trying to offer the very best program we could virtually. And so we've made a lot of adjustments, and in that adjustment period, we discovered the true benefits of technology. Like this evening, coming to you directly through a webinar. We used to do a lot of video conference calls, but we got introduced to the real webinar scene where we could deliver messages to large amounts of people, from 500 to 1,000 people at one time, and technology made that possible for us. So in April, between April and June, once we began to understand the impact that COVID was having on society, we began to monitor all the developments that were going on in COVID. We were looking at all the ways we could mitigate risk and emergencies, and how we could get involved in in the reemergence of scouting after COVID. What would it take? What were the guidelines? And there were literally thousands of pages of stuff produced by the federal government and the local state government that we had to read through and attempt to put a plan together. And so that went along for a while, and we had to make a decision because we hadn't heard anything from the governor related to whether or not the state was going to allow summer camp operations. But what we did know was the excessive cost that came along with all of the things that they were mandating would have forced us to push the summer camp fees way out of proportion in cost. And even then, we wouldn't have been certain that we would be able to deliver the program in a safe manner. And so the board made a conscious decision that we would not run summer camp in the summer of 2020. So we began to build draft plans and documents for what would it take for us to simply reintroduce program at a unit level. And we began to work with various statewide committees. Our very own Brad Murray from the Outdoor Adventures Committee sat on the LARA task force, and they listened to scouting, and they listened to the YMCA, and they listened to the American Camping Association, and they listened to all of the things we would encounter or need to encounter in order to begin to allow units and or individuals in some of the other agencies' cases to be reintroduced to an in-person program. And so once the governor moved her lips and said the shelter was going to be lifted, within a matter of hours, we had 400, 500 telephone calls and emails. And by the second day, we had thousands of volunteer scouters across the state of Michigan clamoring to get back to an in-person scouting program. And so what people did not know at the time was the governor lifted the shelter order, but the LARA documents, the License and Regulatory Authority documents, and the Department of Health and Human Service documents had not been released yet. And when we got them on 2 Fridays ago, there was 317 pages of stuff to sift through. And so once we were through sifting through all the paperwork and the documents over the weekend, there was still this outcry from volunteers to get back to doing unit program and get back to doing in-person activities and ceremonies and Eagle projects and all of those things that have been on hold for the last several months. And as a result, we met, we started talking, we sifted through all of the documents and the language. A number of volunteers and a number of professionals came together in order to put together the documents that we released. Now, hindsight is always 20/20, and in hindsight, we very likely should have waited to release the documents until we had this webinar that we're delivering tonight. But because of the overwhelming outcry from our volunteers, we posted everything on the website first so units could begin to read the documentation and to get started. So we began to take questions and answers related to the paperwork, and we began to hear more telephone calls and more emails. They weren't overwhelming, but there was plenty of them to ask questions about the individual documents and to ask questions about why a waiver and all those sorts of things. And so we worked diligently, and we continue to be vigilant in staying in tune with LARA requirements and Department of Health and Human Service requirements and the Center for Disease Control requirements and the Boy Scouts of America's requirements and the American Camping Association requirements, and the list goes on. We are having to pay attention to all of that on a weekly basis so that as things change, we can be flexible and we can provide the healthiest and safest program possible and give you guidance on how to do that as we move forward so that we can keep ourselves in a position where we're not liable. So there is risk for a potential second wave. You've seen some of it crop up in the area related to the bar in Lansing that has now well over 100 people with COVID as a result of folks not wanting to wear masks. You've seen it crop up over on the west side of the state a little more, and as a result of a little bit too much socializing going on. And where before this was really affecting our older population, this new wave that seems to be popping up here and there is in the younger generation. So it's in teenagers, and it's in our folks in their young 20s. And so there is risk. And so what we're about to talk about tonight brings with it plenty of risk and plenty of conversation, but know that as the Michigan Crossroads Council, our responsibility in this, in providing a scouting program, is to make sure that everyone is as healthy and safe as they possibly can, and that we do all we can as an organization to protect you, our volunteers, you, our families, and our chartering organizations. Now, I know that folks have said in a few emails that have come that said it's all about the MCC. Well, folks, what I'm here to tell you tonight is you are the MCC. You are the Michigan Crossroads Council, and it is all about you. And so as we go through these documents, I'm going to point out some areas that you may or may not have been aware of. But without any further ado, Chris, let's switch slides and let's get into the 5 steps and how did we come about in these 5 steps. So the Restart Scouting Plan has 5 steps. The first 2 are being asked of all registered adults and families. So that is to read the documents that are out on the Michigan Scouting Forward section of our website. Read those documents because those were provided to us by all of the regulatory agencies you see in the second bullet. And those documents are available for you to download, print, do whatever you need to do to make those available for your families, because they talk about things like washing your hands and social distancing and properly wearing masks and how we're going to move forward with things like outdoor activities and all that sort of stuff. So all of those documents in there are for your use in providing a safe in-person scouting program. Step number 2 is related to the waivers. I'm going to come back to the waivers individually in just a moment, so I'm just going to gloss over those for a second. And I'm also going to gloss over the annual health and medical record piece, because that is also going to get some special attention here this evening. But step 2 is for volunteers and families to fill out the appropriate waivers and fill out the Part A and B medical form so that you can have those on hand, because God forbid you don't have an AB medical form and you're doing an Eagle service project and somebody gets whacked on the head with a 4x4 and gets knocked out, and you have no idea what they're allergic to. You have no idea if they have any conditions. You have no idea what's going on with them. So this is not new, but the Part AB medical form is required for everybody. So steps 1 and 2 are for everyone. Step 3 is not necessarily for everyone. It's being asked only of those who meet these restrictions placed by the state of Michigan and have pulmonary issues or are over the age of 60. Now, we've had plenty of people who have said, isn't saying that over 60 has to do this age discrimination. Not when it comes to health and safety, and not when it's dictated by the state of Michigan. So we're only regurgitating the requirements of the state of Michigan. So there is a resource sheet outlining all of these qualifying conditions in the downloads that I talked about in step 1. Now for step 4, this is only to be used by committee chairs, cub masters, scout masters, crew or post advisors. In the case of a COVID incident or an accident or sickness that occurs in your unit during a meeting, an activity, or an event. Okay, and the resources will outline how to complete this form, and you can find additional resources on BSA Scouting Safely website that the national office hosts, and they have videos that show you exactly how to fill out a incident form. They tell you exactly what a near miss form is and how to fill that out. And when COVID's related, they tell you exactly what kind of information they're looking for in terms of COVID. Okay, and so that again is on the BSA Scouting Safely site where you can find all those additional materials. But we have all the required materials in step 1 on our website, and we have all the incident reporting forms also on the Michigan, it's called MI Scouting Forward section of our website. Okay, now number 5 is a point of a lot of controversy, and I'm going to put everybody's mind at ease right now. Number 5 does not belong to you unless a member of the Michigan Crossroads Council staff comes to you and says, we need you to fill this out. Because the Volunteer Services Agreement form is for individuals who are serving on summer camp staff or day camp staffs, or who provide service to one of the council camps or offices on a very routine basis. And the reason why we have to have somebody fill this out is because in the state of Michigan, nonprofits who are part of a nonprofit coalition have a volunteer insurance that we use that is used for workers' compensation. It's not quite like workers' compensation, but it is similar, but it's for volunteers and it has some parameters. But when we have long-term and volunteer employees who are not getting paid, then they need to fill out one of those forms. And you don't need to fill one out. You do not need to fill one of those out if you're in a unit doing unit activities, getting involved in projects and outings and things like that on a unit level. You likely only need to fill one of these out if we tell you specifically, and you're part of the properties committee who comes to camp every week religiously, and you're there helping all day long or 2 or 3 days in a row for weeks on end and those sorts of things. So we will let you know whether you qualify for number 5. And I apologize for any confusion that number has caused so far. Next slide, please. So here's the part that I want everybody to be keenly aware of. We've received a lot of voicemails and a lot of emails that are related to how could you put together such a waiver that asks me to relieve myself of the risk and sign over, the idea of suing the Boy Scouts, etc. If you are a registered volunteer in the Boy Scouts of America, you already did that a long time ago. It's on the inside cover of the adult leader application. And on the inside cover, you surrendered those the ability to sue the Boy Scouts a long time ago. Now, even though you surrendered the ability to sue the Boy Scouts, there is such a thing in the state of law or state of Michigan law that talks about gross negligence. And if we were gross negligent with something, you could still sue us. But this is for, normal activities, etc., that happen in the course of you conducting events and things within your own units or at summer camp or whatever. Now, if that wasn't enough, you also probably filled out a Part A and B medical form, and if you haven't, you need to, because every unit is supposed to have those on file for all registered members. And I would tell you, if you have a guest coming on a weekend camp out, like a parent, I would collect that AB medical form as well. Because again, if something happens to that person, you need to have some kind of a record of what their potential conditions are, and be able to take that with them to a hospital. But on the AB medical form, you also have in the very first paragraph of that form a paragraph that's titled Informed Consent, Release Agreement, and Authorization section. And it's been there for as long as I remember seeing this medical form, and I've been working for the Boy Scouts for 31 years. So you've either filled out a waiver of risk and a waiver of right to sue on the Part A of the medical form, or in the adult leader application, whether you know you did or not. And that all depends on how much you read when you signed it. Now, one of the reasons why we said to everybody when we released the materials were, please read this, is because we were putting all of that information into one form so that we would have one document that a unit could have that would have the release of liability with the protection from COVID, and also be the document that would allow us to implement in-person scouting and get back to doing what we love to do, which is doing things in the great outdoors and teaching kids about leadership and character development and life skills and those sorts of things. So I know there's plenty of people out there who are angry at us for putting that information in a waiver. So we reduced the waiver, knowing that a lot of you have already signed A and B and already filled out an adult leader application. We simply reduced the waiver to a COVID waiver. So the updated waiver that's online right now is an updated waiver. So next slide, please. Here's the waiver. And the waivers that are out there for both adult and youth parallel all of the BSA language in the membership applications, and they are necessary for the Boy Scouts of America to be covered during all of the COVID-19 pandemic. I don't know how many of you remember back to August, September, and October of last year, but we had a small thing going on in the state of Michigan called Eastern Equine Encephalitis, triple E. And before that, we had this thing going on called Lyme's disease that was caused by deer ticks. And we weren't really sure how all that got passed around for a long time until research was done, and the health departments and the science labs were able to tell us, how does Lyme's disease work and what happens with a deer tick and all of that kind of stuff. All of that information is yet to be released about COVID because it's still under study. So the waiver allows us to return to in-person scouting without having to worry about being sued. Now, plenty of volunteers have said, well, nobody else is doing this, which is not true. The waiver that the YMCA has makes ours look like a grade school document. And the waiver that's out there for the Michigan Youth Athletic Association is just as stringent. And we actually took some of the language from there to put in our document. And just today, the NFL released a statement that said they were going to ask all fans to sign a waiver in order to come and watch a football game because they're afraid of COVID and secondary transmission. Everybody is going to be doing this. We just happen to be leading the way in order to give you an opportunity to return to in-person scouting. So the waiver is a requirement, and we would prefer you filled out the new updated waiver just because it's COVID specific. But if you filled out the original one, it counts too. You don't need to do another one if you don't want to, but we would ask you to to sign the updated one just because it's the most current one. But that's the deal with the waiver. And we're not going to get rid of the waiver. The waiver's there to protect our volunteer leaders, and the waiver's there to protect our charter partners. And that was the whole goal with this thing, folks. It was not to protect the MCC. It was to protect our leaders and our volunteers. Okay. So my final statement on this waiver and all the information that's been related to it is not new. It is not new. All right. Next slide, please. So this brings us to the secondary form, or the supplemental medical permission form. The state required people over 60 to not participate in activities of any significant group size. And so rather than just tell all of our members that are over 60, you can't participate in in-person scouting, we looked for a way to try to overcome that barrier. So if you have a pulmonary condition or you're over 60, you take this supplemental medical permission form, you have a conversation with your doctor, and I know that in many doctors' offices, you can just drop it off or send it in electronically, and you can call them on the phone and they will review it, and the doctor will sign it, and then you can pick it up from the doctor's office. We're not asking you to go spend a bunch of money to have a Class C or a Part C physical. We're just asking you to try to speak to your physician and have the conversation. Make sure you understand what the risks are for you if you're over 60 or if you have pulmonary conditions, and anything that's outlined in the document that's in the resource packet. And if you do, get one of these and turn it in. Now, if for some reason your doctor will not sign this, emphatically will not sign it, then as an adult, you can write on there that, I spoke to my doctor, they will not sign this, but I understand the risk, and you sign it and give it to whoever's collecting the paperwork in your unit. For your youth registrants, have mom and dad do the very same thing. If the doctor will not sign that, then you need to take the form and give it to mom and dad. Make sure mom and dad has had a conversation with their scout. And once they've had that conversation, mom and dad are welcome to say, I've had the conversation, my scout understands the risks, and sign the document. And just collect it in your unit and hang on to it in the binder with your AB medical form, your waiver, and your supplemental medical permission slip if you need it. Okay? Next slide, please. Now, the Restart Scouting checklist is on the website. And the Restart Scouting checklist is one of the most important documents I'm going to talk to you about this evening, because it prevents you from having to make copies of waivers and medical forms and supplemental medical permission slips whenever you go to an activity or a function, whether it's with the council, the district, or your unit. Because from now on, you're going to turn in this checklist that lists the name of the event at the top, what district you're in, the Michigan Crossroads Council, and some of you might be saying, well, we're all in the Michigan Crossroads Council, but sometimes we hold events and people come from out of council. So that's why the council line is there. And you fill that out and you put people's names down there, and then you check the boxes verifying the waivers that you have, the supplemental medical form, and the AB health form. If someone has one of those, you check those boxes, and at the bottom, you print your name, you sign it, and you turn this roster in at an event or at a camp when you rent a campsite, or I need for units when they hold meetings, projects, activities, events, outings, ceremonies. Get the picture? Every time you come together, you need to have the people who are there fill out a checklist. So whether you're doing that by taking attendance at a troop meeting, or the den leader is taking attendance at a den meeting, whoever's going to be responsible for doing it, whenever a scouting group meets, they must do a checklist. And then you need to turn those in to whoever's going to retain your paperwork in your unit, and they need to hang on to those for a period of 1 year. Okay? And the importance of hanging on to it is, if COVID should appear after the event, we will know exactly who was in attendance to the event, and we will be able to contact them and let them know that there's been COVID exposure, so that they can then quarantine for 14 days as required by the state, and follow all the state guidelines when exposed to COVID. So, very important for you to understand, a scout is trustworthy. Okay? A scout is trustworthy. And I need for you to collect these unit checklists. And when you come to a MCC district or council function, or a camp function, or a camp rental of a campsite, etc., you're going to have to turn this in. That verifies you have all of those documents with you. Okay? So that's the importance of the checklist. Next slide, please. Okay, a lot of questions flying around the World Wide Web and our email and the telephone about, does the waiver mean that we don't have insurance anymore? Absolutely not. There are no changes in the previous insurance provided by the Boy Scouts of America. So if you're a registered adult member, you are covered with general liability insurance. And it applies to all official scouting activities. And it applies for all primary, it's primary for all registered adult volunteers and chartering organizations. That liability covers your charter partner and you should something occur and for some reason we end up being sued or we're in court. Now, understand that accident and sickness insurance, right, is available to all registered members of the Boy Scouts of America, youth and adult. And it's a secondary policy. So if somebody has personal health insurance, it becomes primary first, and then our insurance will cover the things that your insurance will not cover, up to the limits. And that's basically $10,000 per accident, $7,500 per sickness episode. Now, if you have guests, let's say you've invited a young person to go on an outing with you to try out scouting, and they're going to go camping with you. Yes, they're covered. You invited them to come. If you've invited family to come to a court of honor and somebody trips over a chair and breaks an ankle, yes, that person is covered because they're at your court of honor. As long as it's an official scouting activity and you've invited them there. Okay? So accident and sickness insurance is still in place, and it covers registered members and guests of official scouting activities. Next slide, please. That brings me to the website. So earlier I talked about the MI Scouting Forward site. When you go to michiganscouting.org/MI Scouting Forward, you're going to come to a screen that looks like this. And when you see the screen that says Restarting Scouting at the header, you will be in the right place. On that page, we have steps 1 through 5. We have all the supporting documentation. We have the address for Safe Scouting at michiganscouting.org if you want to send in questions later on, specifically about documents or specifically about something related to this page. We will take your questions and we will get back to you. We've been trying to field them within 24 hours, and in most cases we've been able to. And it may come from a professional and it may come from a volunteer. Lori Champion, our Enterprise Risk Management Chair, has made I don't know how many phone calls on our behalf, talking to folks from an enterprise risk management standpoint. And our council president, Brad Arbuckle, has done the same thing. And our professionals have done the same thing. So if you've had questions, you've talked to one of us. And we promise you moving forward, we're going to continue to answer those questions. And as we do, there's a frequently asked questions section on this page where we're continually updating the information. Okay? And we will continue to do that. Now, how will you know that something got updated? We're going to advertise that weekly in the Michigan Scouter newsletter that comes out once a week electronically to every registered member in the Michigan Crossroads Council. And so we will have it on the website. You can check there. Okay? We're going to push it out to you in the Michigan Scouter. And if it's super important, we're going to send you a direct email that will outline the update that is being done on the website so that you can stay current as you possibly can be with the information as we get it. All right, next slide, please. So a little bit of the a rehash on the restarting scouting plan for in-person scouting activities. We have scouting guidance documents, and they're on the website that we just showed you. We plan for and intend on you using those documents to plan and equip yourselves to provide activities, outings, meetings, ceremonies, you name it. All of the required documents are in there for social distancing, how to wear a mask, how to build a mask, how to wash your hands. All of those things that are required are in there. So please use those documents. You're going to look at those required forms before any and all in-person events to make sure people are familiar with those forms. So this is going to become routine, not just with the Boy Scouts, but with about any agency or sports team that you participate with. They're going to talk about washing your hands. They're going to talk about safe distancing. They're going to talk about wearing a mask. And I know all of this is irritating because it's change. And none of us really like change. But this is required for in-person scouting to return. All right. So provided we follow all these guidelines and requirements, units are allowed to return to in-person scouting activities. There will not be district or council in-person events at this time. Unfortunately, there's a whole lot more requirements that we have to comply with at our facilities and to run large events. And right now it's cost prohibitive for us to get engaged in those. And we're hoping that these things will soften over the summer. And we will get back to you in August with a full plan for the fall of what's going to happen this fall. Scout offices, scout shops are all going to reopen in phases. And that document is on the web as well. So on some of the scout shops are already open 3 days a week. The Ypsilanti Scout Shop is going to open on the 6th. And then the rest of them will open after August the 19th. The scout offices, however, that's scout shops. The scout offices will not officially reopen at this time until after the Labor Day holiday. So that will be September the 8th. And on September the 8th, we will be fully manning our offices, and we intend to reopen on that schedule as of today. But like I said earlier, Semper Gumby, you need to be flexible, because when things change and we're given different guidelines, that may change the processes we're talking about right now. So with these in-person scouting activities that you're going to do with your unit, you can also come to our camps, and we have 30 campsites that are open. There's 10 at D-Bar A and there's 5 in the others. They're open and available for tent camping only. There will be individual sites with water and latrines. Nothing else will be provided. If that site happens to have a pavilion in it, super fantastic, you can use the pavilion. But in all of the other common spaces in the camp, there will be no picnic tables. They'll be roped off. We're asking you not to gather in those areas because we're going to have to make sure things are sanitized and cleaned. And when I say we're going to have to make sure, you will sanitize and clean your site and your own latrine. We're going to provide you with all the chemicals to do that. And we're going to provide you with all the instructions. However, we're going to have to follow the guidelines that'll be posted there in the material safety data sheets. And we're going to have to follow the frequency in which the CDC is requiring us to do all of these guidelines. So with continued vigilance and flexibility, as I mentioned earlier, for those of you that aren't familiar with the term Semper Gumby, it means flexibility. And so we're going to continue vigilance and flexibility, and COVID-19 is not gone. And absent of us paying attention to these things and agreeing to follow these guidelines, there simply will not be an in-person scouting program until there's a vaccine. So we need your cooperation. We're counting on you. We appreciate you and your commitment to scouting and the youth served through our efforts. Together, we're simply taking as many precautions as we possibly can for everyone's benefit. Charter partner, you as a leader, the families we serve, and the Michigan Crossroads Council. So what does this, all mean? It means if we work together, we can continue to make a difference in the lives of the kids that we serve. So I thank you for listening to this presentation this evening. Again, if you have questions, you're welcome to put them on the chat. I see that there's 21 questions on there. I'm going to ask Lori Champion and Brad Arbuckle to open their lines, and we're going to begin to answer some questions for you this evening. And again, when you're done, at this address on the screen, Safe Scouting at michiganscouting.org, if you continue to have questions, please send them to that address, and we will address them just as quickly as we can, but our intention is to try to get to them within 24 hours. So with that, we'll go to the question and answer session. All right. Okay, how is the governor's announcement today about going back into stage 3 going to affect our restart? So, I don't know, Brad, do you want to address that?
Yeah, so here's what the deal is. It just came out. We're going to print it out. We're going to analyze it, and we're going to see whether and to what extent we can go forward with this restarting program the way we've outlined it. Since the original version of stage 3 came out, they've opened the state camp subject to a lot of guidelines that hadn't existed before. The LARA documents are out. So we need to look at it. Again, this goes back to Don's point about being flexible. We're going to look at that order, and it may say it's stage 3, which limits certain things, but you can still camp, or you can do camping in a particular way. We'll need to get that nailed down, because we need to understand if it's the old stage 3 verbatim, or if it's sort of a modified stage 3 permitting some social gathering subject to social distancing and the like. So we need to look at that, and we'll have to get back to you on it.
Yeah. And again, we're going to put that out through the Michigan Scouter, and if we have to, we'll send out messages via email to all registered members. Catherine asked, where do we send the documents after we fill them in and sign them? They are to be collected by your unit and held on to by a member of your unit who is designated by your unit committee chairman. Now, that might be your committee chairman, or that might be a designee of your committee chairman, but that's a conversation that you want to have with your committee and your charter organization representative. But they're to be held on to by your unit, and all you're going to do is turn in the checklist each time you come to a function for the district or council, and you're going to make a checklist available each time you conduct a unit meeting or activity. Anytime you conduct a scouting related activity, a checklist appears. Can forms be turned in and saved digitally? The answer to that question, Katie, is no. And the reason they can't be saved digitally is because then we start getting into some HIPAA regulations. And we want to avoid those right now. We do have a company that we're working with, and we're going to roll out this summer for summer camp, called Camp.doc. And Camp.doc was a digital resource where we were going to be able to store our medical forms. We're going to work with them between now and next year to see if they will be prepared to store our documents. And as more information on that becomes available, we will certainly let units and charter partners know. But right now it's hard copy only. And there's, you have to understand that to meet the personal information integrity rules, you can't have more than 3 points of personal information on a document. So name, address, and birth date, name, address, and some other considerably personal piece of information, social security numbers, things like that. So we're asking, because these are not necessarily PII documents, they can be held by somebody within the unit. And typically that's the person who's carrying around the 5-inch 3-ring binder that has all of the medical forms in it and all that kind of thing. So hopefully that helps answer your question. If an adult does not follow step 3, where they are required, are they in violation of law? Is there an offense that is committed where they expose themselves to state fines or legal recourse? I'll leave that to you, Brett.
Yeah, so the answer is, are you in violation of the law? No. Step 3 is there because the categories that are listed on there, over 60, certain physical conditions and the like, we know, the doctors know, that if you are in one of those categories, your risk of a severe illness, hospitalization, and possible death is substantially increased. That's what we've learned from the COVID experience so far. And the reason we put that form is there, and it ties back to the assumption of risk, if you have those issues, we really want you to think twice about whether or not you ought to be participating. Because the interesting thing about COVID, many people are asymptomatic. It may not seem that they have it, but if you're unfortunate enough to get tagged with it and you're in one of those categories, it can be pretty nasty for you. And so as much as we enjoy scouting, as much as we'd like to have people participate, we really want people to think, long and hard about, if I'm in one of these categories, should I be doing this? And we want you to talk to your doctor, because your doctor may give you an explanation and say, but based on your overall health record, I think you may be okay. Again, we want people to make intelligent decisions, and we want to reduce the risk. And that's the purpose of the form. So if you check all the boxes and you still participate, are you violating the law? No, but you are assuming some pretty significant risk.
Okay, there's a question here that has nothing to do with tonight, but I'm going to answer it anyway. This says, why does the print on the CBC form or agreement ask to go into your bank accounts and other financial matters? The CBC document is something completely different, and it's administered by the Boy Scouts of America. And that CBC document has several things in it because of a variety of reasons. One, it has to be compliant with all 50 states. I don't know if any of you have ever lived in California or have ever lived in New York State, New Jersey, they're very, very regulatory, and the language that they require in a document has to be, if we're creating a single document for all 50 states, it's going to be complicated because of those 3 states. Now, the reason it talks about bank accounts is because none of you on this phone, I'm sure, are going to rob money from the popcorn sale that belong to a unit somewhere. But somewhere in America, there's been volunteers who have done that. And so they've set a precedent. And as a result, it allows the legal system to look into a bank account to see if any money in a similar amount has been deposited into the account. Okay, and so that permission gives them permission to do that. Nobody's ever going to do that unless you're in legal trouble and you've stolen some money, or you're being investigated for having stole some money. Okay, hopefully that handles that. And Verna, if it doesn't, feel free to reach out to me directly. I'm happy to have a cup of coffee with you and talk it over further if you need to. Bob says, so to be clear, the state of Michigan has stated that people over the age of 60 can no longer participate in large group events such as scouting, high school football games, concerts, movies. That is their recommendation. That is correct.
Right. It's only a recommendation. Right. And they want you to think about it because of the risk, the health risk, the possibility of death, extensive hospitalization. They've never said you cannot do that if you're over 60. What they've really said is, we want you to think long and hard about this because COVID is serious. And so you're really going to have to make an individual evaluation of, do I want to take on that risk, particularly when it's an invisible thing. And people, you got the concept of super spreaders, they're asymptomatic. People don't even know when they're spreading it. And yet we do know that if you're in large groups, and if you're not outdoors and you're not wearing a mask and you're not washing your hands and you're touching your face, you're at a very high risk for infection. And again, if you're over 60, the impact of COVID on you is going to be substantially higher than on an 18-year-old.
Well over 80% of the deaths that have occurred in the state of Michigan have been in the age bracket of over 60. Okay. Okay, James asks, is the 5-step process going to be rewritten with this new information? It already is. It's already available on the website, and it went out earlier this week. Is the webinar going to be available on an ongoing basis? The answer is yes. We've recorded the webinar from noon on yesterday and then tonight, and this webinar will be posted online on the same Michigan Scouting Forward site is the rest of the documentation. Okay, moving down here in the questions. We complete the checklist for every weekly Cub meeting. The answer to that is yes. So a den leader would do it for their den meeting to show who was there. Now, if you want to keep one and you want to keep track of dates with the 7 kids you have in your den, super. Then you want to have their name on one checklist and just put the dates down. I'm okay with that, provided that you're turning it into whoever's holding your paperwork, once a month, so that they have that in case there is a problem. We can get back with those families. But yes, for any scouting activity, meeting or otherwise, we need to do one of those checklists. All right. The other thing I would like to say about that at this time is, as it relates to ceremonies like Eagle Scout ceremonies or blue and gold banquets or those types of things, we know that it's going to be very, very difficult to collect waivers from everybody who comes through the door. But we do need you to collect from your guests name, legibly, a name, and a contact phone number that we can get a hold of them with, so that if something happens, we are able to notify them of a COVID incident. So please make sure that at the very least, you're collecting a roster with the name and phone number of the people who are guests at your meetings or ceremonies that are going on. If you're doing a weekend camp out, or you're doing a day-long activity or an Eagle Scout project, unfortunately, I'm going to have to tell you, you got to collect an AB medical form, and you got to collect an adult waiver from those participants helping out on those things. Because again, for reasoning, if something happens, you will know their health history, etc. And after that, after the project's done and we find out that you were exposed, again, you need to be able to contact those folks, even though they're not registered members of Scouting.
Right. Here's what you need to keep in mind with respect to things like courts of honor, meetings, those sorts of things. They are clearly gatherings that enrich our lives. And in the past, we didn't really have to worry about it. But the problem now is those very events are potentially events that can spread COVID, all right? And the more time that you spend together in that group, the greater the likelihood that you can be exposed to COVID. So when the grandparents come to the court of honor, let's say it lasts a couple hours, probably not a big risk, but we would strongly encourage you to encourage them to wear masks and to socially distance. The mask is your best defense against COVID, and it's not perfect, but it is a good way to keep you from infecting others and others from infecting you. So what we're really asking is, at things like courts of honor, some of these other things, we want you to think about how you're going to conduct it with the strong recommendation of mass and social distancing, because the goal is to facilitate these events, but make sure people are safe and there's not undue risk. And when we talk about the grandparents at one of these events where you're mixing and matching people from different families, they're most likely in one or two high-risk groups to begin with. And so we just want people to think that through. You know, we're not trying to say no, but we want everybody to be smart about it, and we want to make sure it's safe.
Okay, and the next question has to do with popcorn. How does this affect popcorn? So the popcorn sale is going to continue until we're told it can't. Popcorn sale continues. The popcorn committee is meeting right now, and they're talking about safe ways to conduct the show and sells and also the wagon sales. And don't forget that also in the popcorn sales, we have the app, and we also have online sales. And there's some incredible programs going on right now in the summer related to the online portion of and the wagon sale portion of the popcorn sale for the fall. So Jamie, if you send me an email directly, I will connect you with Gary Gilger, who works with that program on a statewide level, and I'll have Gary connect with you directly. All right. That way, if you have specific questions, you can get them answered. Next question is court of honor related. I think we've answered those. What if someone cannot wear mask? Can they wear a shield? The answer is yes, sure. They're welcome to wear a shield. They need to, basically it's called sputum. They need to protect their mouth from the sputum that comes flying out that you may not see. And a mask or a shield will do that. And it'll protect their face from somebody else as well. How many people are allowed at a meeting? We continue to follow the CDC guidelines at whatever stage we're in. That's obviously questionable right now. And so we'll be getting back to you with numbers right now. But it was 100 outside, and I think last week it went to 200 in certain areas of the state last week. And it was meetings of 10 inside, and it depended on the size of the room. And if it was a sizable room, it was 25% of the capacity that was posted on the fire chart. So those are the numbers we're currently operating under. And as we review what what Section 3 looks like now, we'll get back to you if that changes. Okay. Somebody's asking about the webinar again, and yes, it will be posted, and yes, you can view it again. So in the email titled Restarting Scouting, what you need to know is there is a statement that reads, a unit leader who does not comply or fails to comply should be aware that he or she is essentially accepting liability for their unit, charter partner, volunteer leaders, members, and program. Does this mean that a unit leader does the best job possible of complying with the guidelines, but fails in some respect that the unit leader is deemed liable? The answer to that is no. You're not deemed liable. You're doing everything you possibly can to provide a safe atmosphere to deliver scouting. And if you have someone who is refusing to follow any of your guidelines, then don't be confrontational. Separate the group from them if you can, and then let them know that they're not invited back to the next meeting without being compliant to wearing a mask and social distancing and the things that you are requiring, because they're putting your folks and you at significant risk, whether they think they are or not. Because like Brad said earlier, they might be asymptomatic and they don't know it. So it's important that we all comply and wear masks or shields and those types of things when participating. Hopefully that helps you.
I mean, what you need to do is take the time and read the documents and try to do your best. That's really what we're asking for. And to be blunt, you know, I got a lot of emails as soon as the governor said the thing was open that people were just going to race off and do stuff. Well, you can do that. I can't really stop you, but that's where we're concerned that you could be taking on risks. So that's why we've tried to educate everybody with these materials, and we'd like you to try and follow it as best you can, because when push comes to shove, you'll be able to say, I did the best I could. I followed the guidelines. I looked at things that the doctors, health authorities, and the like propose, and it can happen. But you'll have taken steps to show we tried to protect people. We tried to do no harm.
So there's a question here from Greg about, biggest question in mind for him is, are there some guidelines about cooking at a unit or district campout? So there's a link in the waiver that's currently online to the LARA requirements, and the LARA requirements cover some of the outdoor cooking guidelines and things of that nature. We have not downloaded a specific document, but we will try to pull a document together, Greg, and make it part of the resources that are listed there in step 1. And if you give us a few days to do that, we're going to have to pull it from here and there, but more or less, it's following the social distancing guidelines. It's washing the hands, covering the face, and then, you know, as it relates to serving, making sure that you're serving with gloves on if you're serving. If it's self-serve, everybody has to have clean hands and that sort of thing before they come to use the spoon or whatever. I know that you can only do your best with that as well with your scouts. But we will make sure we get something on there for you. Okay. Is there guidance available to units on how to complete unit camping activities? So yes, there's some guidance there, and it's following the state guidelines. It's related to social distancing. There's guidance to transportation on that site. There's guidance to camping on that site related to one person, one tent. There's lots of guidance on there, Adam. But if you don't see what you're looking for, talk to us and we'll guide you to the tools you're looking for. Okay. What qualifies as an official scouting activity? If you're doing a unit activity and you know, you're involved in a set activity, and you've invited the folks to come to it on behalf of scouting, that's an official scouting activity. If you're attending one of the events that's held and hosted by the Michigan Crossroads Council or one of its districts or the Order of the Arrow or that kind of thing, that's an official scouting activity. So your question is, does an event provided by an organization such as the American Legion qualify? No, it doesn't, unless it's an official scouting activity. If the American Legion is your chartered partner and they've invited you to come and work a pancake breakfast and you agree to do that as a unit, that's a scouting activity. If the American Legion is conducting a pancake breakfast and you as a member of the American Legion and a leader go there and you get burnt, you're not covered under scouting insurance. That's not a scouting activity. That's an American Legion activity. So it needs to be an official scouting activity designed to deliver the mission of scouting. All right. And if you do have an official activity, yes, it's covered by the insurance, which is on the screen now.
But the other thing you need to understand is it should not be a prohibited activity, so it's got to comply with the Guide to Safe Scouting. All right? And you ought to look at the BSA website to get a feeling for the kinds of things that they say are prohibited activities. And that's all. And if you're doing one of those activities, whether it's post-COVID, pre-COVID, it wasn't covered by the insurance. So again, we'd encourage you to review the Guide to Safe Scouting, go to the BSA website, and make sure you're educated on what is, you know, the scouting activity and making sure it doesn't fall into the category of a prohibited activity.
So Brad, this is Lori, just for clarifying, so that people aren't confused. Prohibited activities are typically things like that you wouldn't do anyway, but somebody tried at one point or another, like skydiving or building a catapult and throwing anvils through the air. You'll find a whole list of that type of thing, as Brad has described.
Perfect. Cliff says, I know that some troops have decided to go out of state to camp where restrictions are not the same as in Michigan. What issues does this create for Michigan troops as far as insurance and other regulations? You have to comply with the regulations of Michigan, and you have to comply with the regulations of your destination. So
Right.
You need to know what those are in both locations. Your insurance will provide you coverage because it is an official scouting activity. However, you need to be very, very familiar with whatever the regulations are between here and that said location. I'll give you an example. I had a leader call that said, I'm driving to the sea base with my group. We're stopping twice along the way. I said, super. You need to know what the regulations are in Michigan. You need to know what the regulations are in the two places that you're stopping along the way. And you got to follow those. And you need to know what the regulations are at the Florida Sea Base. And
Right.
so that is something that's incumbent upon you as leaders to know before you embark on these types of trips. Go ahead, Brad.
Right. And the issue for you is going to be this. The place where you're going to may require you to quarantine for some extended period. And when you get back to Michigan, I got to look at what the governor put out recently, but you may be required to quarantine for up to 14 days. So you really got to understand the regulations, where you're going to and how you're going to get back, because it's not just as simple as it used to be where get in the car, get on a plane and just go.
Okay. Verna asks, can Part C of the medical form surpass the over 60 waiver? The answer to that is no. We want the over 60 waiver filled out if possible. If somebody's going to get a Part C, just take that along. They'll sign it. I'm actually going tomorrow morning to get my physical, and I've already asked my doctor because I have asthma. Will she sign this form? And she said, absolutely, bring it along. You know, I would say take the form along, and as Part C gets filled out, just hand them that one and have them fill that out, have the conversation, sign it too. And again, if they refuse to do that, then, you know, you can say you've been to the doctor, You've talked about it with the doctor. Doctor refused to sign. You sign it. Rich asks, can I cover the 1099 topic? And I can. So if you're one of the very few people, less than 100 in the state, that's going to fill out a volunteer form for, sure, the name just went right out of my head.
Services agreement.
Yeah, hang on one second. I'm going to get the right name. So it's volunteer service agreement. If you're the person who's filling out a volunteer service agreement, and you are a long-termer with us, and let's say you're coming to camp on the weekend, and you're staying there from Friday to Sunday, and you're doing it for 3 or 4 weeks in a row, which is a really nice thing to do, but the state government, who has already pinched the scouting program and others for what are considered perks or benefits, consider that to be a benefit. So let's say that cabin is on the lake, and so you basically are getting the use of a lake house for 3 weeks a month for the summer. Well, that's a benefit, and they call that board, or room rather. And if we happen to feed you, they call that board. And so we're supposed to give you a 1099 if you receive certain perks and benefits. And that 1099 just says you receive the following benefits from the Michigan Crossroads Council, Boy Scouts of America, and therefore you need to record that on the appropriate taxes, on your personal taxes. We've only issued a few of those annually to individuals, and it's usually for things like they're volunteering to be a leader at camp all summer on the camp staff. And because we're providing them room and board, we got to give them a 1099. That's really the most typical one. But a 1099 is not required for all volunteers, and all volunteers who come to do work at camp for a weekend or for a day or whatever are not going to be asked to fill out that form. And yes, you'll be covered by accident and sickness insurance. So be clear, that form's only for a few people, and the 1099 is really issued to even a lesser number than that. All right. Is there any way to upload names to the Restart Scouting Unit checklist? We could make the Restart Scouting Unit checklist a fillable PDF. I don't think that that's too difficult. While I have them on here, Chris, do you want to unmute and answer that question? Can we make that a fillable PDF? We can't hear you. Or for whatever reason, I can't hear you. Why don't you send me a text and I'll come back to that.
Well, there we go. I think,
There you go.
can you hear me now?
Yes.
Okay. So the form is fillable online. Does not have the ability to upload names, but you can type them in, save it, and then print it out as needed.
Perfect. Okay. Our activities that would require scouts from not wearing a mask, like swimming, life-saving, not being allowed at this time. So in many places they are not being allowed at this time, but where they are being allowed, even in the LARA guide documents, it indicates that a lake, for example, is not a transmittable source. You can transmit it there. Don't take that wrong, but it's not a breeding ground for COVID. And all they're really asking people to do is follow the social distancing guidelines in the water. And so I've had a couple people say, well, what does that do to the buddy system while you're in the water? So that's a challenge. So you're going to be counting pairs 6 feet apart from one another. And I guess you're going to be pointing to your buddy. I don't really know how councils are handling that. Our camps aren't open this summer. We haven't prepared for that. So I'm not sure how other councils are going to be handling it.
And Don, if they do come for assuming we can still allow weekend camping at our properties, the swimming areas generally aren't going to be open, and we're not providing lifeguards.
Correct. So our camps, I made the statement at yesterday's webinar, which I need to change. So somebody asked, if we rent a campsite, can our kids go fishing and swimming? Yes, you can go fishing. No, you can't go swimming. And it has nothing to do with COVID. It has to do with the fact we're registered and licensed to operate a camp in the state of Michigan, a summer camp. And if we run anything that resembles program, and that includes opening the waterfront, it's considered an adventure activity and must be staffed. And once I have to staff the waterfront, then I have to have a nurse in camp. And once I have a nurse in camp, you see how the dominoes start falling? So we will not be offering the swimming beaches. You will be able to fish. All right. Just pretend like it's November and no one wants to go swimming. You're right. Just trying to offer a little bit of levity to this topic. Now, another question here. Step 5, volunteer form can be updated in writing to state this is not needed for parents, leaders, and PAC volunteers. Having it stated verbally was good to hear, but having it in writing and saying we do not have to sign would be beneficial. We can do that. Chris?
Well, it won't be required unless we, the council, in the unique situations, ask it to be done. So you at the unit level really don't have an obligation to focus on step 5. All right? Because it's really not going to apply in that scenario. We can clarify the language in the step 5, but generally the decision as to whether or not such an agreement will be required will be made at the council level.
Okay. Greg asked the question, can we have one waiver signed and one completed set of health forms and carry them to each one of the unit activities, et cetera? The answer is yes. The only sheet that you need to do each time is the checklist. So once you have everybody's stuff on file, it's good for a year, just like the health form is good for a year. And so when you renew your health form, you need to renew your supplemental medical form if you have one. The waiver, however, is good for ever. Okay. Once the waiver is signed, you don't need to recollect it. Okay.
But to that end, so when you're holding these multiple events and you got the waivers in front, what you are going to want to do is ask people, as they're attending new, are you still feeling good? No temperature, you're not feeling sick. You know, it's a good practice to find out if anybody's recently has the symptoms. That doesn't require them to execute a new waiver, but you ought to be asking at your events, how's everybody feeling?
Right. Okay. Let's see here. Tom's asking, what if you can't wear a mask? If you can't wear a mask, wear a shield. And if you can't wear a shield, there's some concern that if, you know, maybe you need to get tested. And if you're tested and you're not asymptomatic, then you'll need to take your temperature before you go to an event and make sure that you're not reading a temperature over 100.4. These would be very, very unique situations of someone who can't wear a mask and can't wear a shield.
But with respect to those people, social distancing is going to become very critical.
Yes, absolutely. The same thing for the next question that talks about masks in children, particularly under the age of 4 and infants. So infants aren't a problem. They're not going anywhere. They're in their mom or dad's arms. But children under 4 tend to be very, very energetic and run around. And if you can't keep a mask on them, again, we need to follow the same guidelines that I just talked about. All right. If you're over the height, weight recommendations, do you need to fill out a supplemental medical permission form? I don't recall seeing a height, weight recommendation in the restrictions. Lori, do you recall seeing that from a risk management standpoint?
No, but there are some considerations, related factors. For example, there might be hypertension or something like that. So you should really read the whole list to be sure.
Yes, thank you. Okay, how does this affect the number of youth in tents for camping activities? That's listed in the documents, and we as a council are asking for one person to a tent. Somebody on yesterday's call said that doesn't that violate youth protection? It does not. Youth protection is within hearing or seeing distance. And so tents have very thin walls, and they're generally, as you have buddies, you can put those tents close together, and then that fulfills the buddy requirement. And so you have, the tent is safer when there's one person in it as opposed to two. All right. This is perceivably confusing. Not sure how we can expect volunteers and families to follow it. What I'm hearing from leaders is it's confusing and seems unimaginable. Well, we're doing the very best we can, Steve, to offer a program that's in person, so in-person scouting can occur. I don't think it's terribly confusing. If you'd like one of us to talk to a group of parents or to talk to a group of scouters outside of these webinars, you can either send them to the webinar or we'll be happy to talk directly to them. But these are the requirements, and this is what is going to have to happen for us to continue with in-person scouting.
Right, and that's the key point to remember. We didn't create this to make things a pain in the ass or to make them confusing or anything. As Don indicated early in the presentation, we spent a lot of time looking at how we could have group interaction to facilitate in-person scouting. And with the things that we've read and what's been recommended by the health authorities and doctors and the like comes down to this. And so again, it's really a personal choice, but it's one of those things where we want people to be safe. And if you can't manage this program or you don't believe it's workable, then you probably ought not to be doing in-person scouting because the risk is going to be high, and we'd like you to do the virtual scouting program that we've teed up. We're trying to make it feasible and capable, but again, this is a great unknown, and it's pretty serious and pretty risky, and we need to be able to ameliorate that risk.
Yeah.
Hey, Don, it's
Yep.
Lori. CDC did update their underlying conditions list. So a BMI of 30 or higher is considered an increased risk factor for COVID-19. So I need to change my prior answer.
Okay, very good. Cliff is asking about transportation and vehicles to keep scouts safe. We have a document in there that refers to that. We are asking for kids to be transported by families. When that's not possible, we're asking for the kids that are transported in the vehicles to make sure that they're keeping their masks on, and that we're discouraging carpooling. Okay, and I'll leave it at that. Can the unit checklist be? Can the MCC checklist be modified to use one of our own, provided we use the MCC language?
Our preference would be that you use our forms, but you can definitely supplement it with your troop form.
Okay. Recommend that the unit checklist include a symptom check, fever check and exposure check to indicate those were done for each attendee. So in the paperwork, there's a list of things we're supposed to ask when people attend. Same questions you've been asked at everything you've been attending lately. For example, have you been exposed to anybody with COVID? And, the list goes on. Well, if your unit wants to add that to your form, you can. I would suggest you print out a little card that says, here's the questions that we need to ask. and that you don't necessarily have to put that on a document. We're trying to make this simpler, as simple as we possibly can, but that's good advice. We'll take that into consideration. Let's see.
So in terms of the weight height restriction on Part C of the health form, we still would like you to put out or consider the supplemental sheet that we have prepared, because that document is very COVID specific. You know, it goes beyond just what's the weight height restriction. And so if you've got your Part C and you meet the standards, great. But if you've got one of the issues that puts you at a higher risk that's on that supplemental form, we want you to look at it, analyze it, and make an intelligent decision.
Yeah, so there was a final question we're going to take for the evening, and then the remaining questions, if someone has one, can be sent to safescouting@michiganscouting.org. And that is, I've noticed that updates or changes have been occurring to the forms. Will future changes and updates be sent to Key 3s to keep them in the loop as well? All updates and emails that we've sent out have been sent to every registered member. So if for some reason whoever sent that question has not been receiving those emails, please connect with us and we will make sure you get those emails, because we've been sending them all out at the same time to our staff, to the registered scouters, to the charter partners, etc. So you can send all kinds of questions, anything you want, to communications@michiganscouting.org or safescouting@michiganscouting.org. They come into the same people and they will field them and send them to the right folks to be answered. So ladies and gentlemen, I want to thank you for all you do for Scouting. Without you, this program would not be possible. I want to thank the members of the board that were part of this and the members of the Scouting community that were part of this, because they weren't all board members. And I really want to say that there has been literally thousands of hours poured into putting all of this stuff together to return Michigan to in-person Scouting. So I want to give my personal thanks to each and every one of you for what you do, and to each and every one of those people who helped to put this together, regardless of how confusing it is, helped to put it together so that we could get back to in-person Scouting. So with that, we hope to see each one of you on the Scouting trail, and we wish you a good night.